Hi, this is Deena Cohen from GoMo Health, and I'm going to talk to you today about the rise in mental health disorders and substance use disorders among adolescents. It's a growing concern and trend that has garnered significant attention from researchers, healthcare professionals, policymakers, and communities. Several factors contribute to this increase. Number one, the stress and pressure. Adolescents today face unprecedented levels of stress and pressure from various sources, including academic demands, social media, peer relationships, family dynamics, and future uncertainties. The constant pressure can contribute to the development of mental health disorders such as anxiety, depression, and eating disorders. Number two, social media and digital technology. The pervasive use of social media and digital technology has both positive and negative effects on adolescent mental health. While these platforms provide opportunity for connection and self-expression, they also expose adolescents to cyberbullying, unrealistic body standards, and constant comparison, leading to feelings of inadequacy and low self-esteem. Number three would be the trauma and adverse childhood experiences, also known as ACEs. Exposure to trauma and adverse childhood experiences such as abuse, neglect, household dysfunction, or community violence significantly increases the risk of developing mental health disorders and substance use disorders later in life. Adolescents who have experienced trauma may turn to substances as a coping mechanism to numb emotional pain or escape distressing memories. Number four would be substance accessibility. Despite efforts to restrict access to alcohol, tobacco, and illicit drugs, adolescents still encounter opportunities to experiment with substances. Easy access to substances, coupled with peer pressure and curiosity, increases the likelihood of substance experimentation and subsequent development of substance use disorders. Now let's look at some of the barriers. Number one would be mental health stigma and barriers to treatment. Stigma surrounding mental health issues often prevents adolescents from seeking help or disclosing their struggles to others. Additionally, there may be barriers to accessing mental health services, including lack of awareness, limited availability of specialized care, financial constraints, and concerns about confidentiality. Number two would be changes in family dynamics including parental divorce, family conflict, substance abuse within the family, and unstable living environments can contribute to adolescent mental health problems and increase the risk of substance use disorders. A lack of parental support and supervision may also exacerbate these issues. And number three, as a barrier, would be cultural and societal factors. Cultural and societal norms regarding mental health and substance use can influence adolescent behavior and perceptions. In some cultures, mental health issues are stigmatized, leading to reluctance to seek help or discuss problems openly. Societal attitudes towards substance use may also affect adolescents' attitudes and behavior. So in conclusion, addressing the rise in mental health disorders and substance use disorders among adolescents requires a multifaceted approach that encompasses prevention, early intervention, access to quality mental health services, supportive environments, and stigma reduction efforts. By addressing underlying risk factors and providing comprehensive support systems, it's possible to mitigate the impact of these challenges on adolescent well-being and promote positive outcomes.